first moved to town, and before we had internet, I went to elevations every day to prepare for my classes and stuff. So I have kind of a special place in my heart for them. Okay, so final topic for today, obstetrics and neonatology, again, might more easily have followed female reproduction, except that the cardio lecture was so long, I wanted to have it earlier in the day rather than toward the end here. But anyway, so we're talking about fertilization, pregnancy, childbirth, and all of the myriad things that can go wrong and what we have to call them. Structures related to pregnancy. First of all, how we relate to them. Obstetrics is pregnancy, prenatal care, everything that goes on before birth. Neonatology is dealing with a new baby. So it's suddenly completely separate from the mom, although, making sure that the mom does the right things is important, but neonatology is dealing with the individual baby afterward. Some terminology: the gamete is a mature egg that has been ovulated out and is now on its way down the fallopian tube. Ovulation is the expulsion of that ovum. Conception or fertilization happens when the sperm fuses with the egg, injects the DNA, and now you suddenly have the gamete has 26 pairs. So it has all 46 chromosomes, 23 pairs, all 46 chromosomes. A zygote is the fertilized gamete. An embryo, from the time the egg implants, it's not an egg by the time it implants, it is split and split and split, and it's a ball of cells called a morula, and has at least several hundred cells by then, if not more, and it implants and becomes an embryo. So for the first few weeks it's called an embryo, and then it becomes a fetus. Fetus is from the ninth week of pregnancy and onward. Gestation is the time it takes for the child to grow in the womb. Pregnancy is sort of like gestation, but the gestational period speaks specifically of the growth. Being pregnant means that you have an implanted fetus at any time during that period. Implantation, the embedding of the zygote or the morula in the wall of the placenta. The placenta, not the wall of the placenta, the wall of the endometrium. The placenta is actually what is produced by the growing fetus. It's its own blood supply at that point, and it grows out and spreads across the endometrium, kind of fuses with it, and is the growing fetus's blood supply, while as the endometrium provides the mother's blood supply, once again right next to each other, so close that there's immediate exchange of nutrients and oxygen. The good thing is that they are actually separate, so that if there are incompatibilities, they usually don't show up, at least during the first pregnancy, because the mother hasn't recognized this growing alien in her and produced antibodies against it yet. The amniotic sac is a membrane that surrounds the fetus. It's full of amniotic fluid. The chorion is the outer layer of the placenta. It's called the chorion, and it will produce a lot of hormones. It's interesting, the mom is producing hormones from her pituitary and from her ovaries to create the egg, or mature the egg, sustain it until it can implant. When it implants, her hormonal level drops back down to relatively normal, and the placenta that's growing has to hurry up and take up the slack. if it doesn't start making some of the hormones that mom was making, you'll have a spontaneous abortion. You'll go ahead and menstruate. So it has to be a pretty close call here. You start making these placental or chorionic hormones, and you can test for those and tell whether the woman's pregnant or not. Because you wouldn't be making placental hormones unless there was a placenta growing. The amnion is the inner layer, and therefore has the fluid in it. And here we are again. We have fertilized the egg, usually about here, very close to the time it's entered here, very close to 24 hours after ovulation is the sweet spot for getting an egg fertilized. And then it has to grow and grow and grow and produce more and more cells and arrive just in time when the endometrium has grown right to the most receptive. It implants and actually invades the tissue and then starts growing the placenta in there. The placenta then is growing here next to the endometrium. The amniotic sac is within the placenta and the amniotic fluid inside that, and the baby growing inside that. Embryo and then fetus. 67 days. So talking about these structures, amnio or amniono refers to the amnion or the amniotic fluid. Choreo is the chorion or placenta. Now you can also say placental. There are some placental things, but most of the terms are going to use the choreo thing. Embryo for embryo, feto or feti for fetus. Gravido, remember that means pregnancy, a very grave condition. Lacto for milk. Nato for birth. So prenatal care means caring for the kid before birth. Postnatal means afterward. Neonate, newly born kid. Omphalo means umbilicus or belly button. If you punch somebody in the stomach, they go oomph. Omphalo. Parto and puerpero are two other names for childbirth. You know, unfortunately, childbirth is even more important than pregnancy and peeing. So we have a kind of an absurd number of different terms with just tiny different meanings in referring to childbirth. So you're going to just kind of have to get used to which one gets used where. Partum usually refers to childbirth from the mother's perspective. Nato refers to childbirth from the kids. You know, prenatal care is of the kid. A neonate is the kid. Postpartum blues has nothing to do with the kid, that's the mom. So childbirth on the part of relative to the mother is more likely to be partum something. Antepartum, postpartum. Cephalo means head or brain. Usually cephalo, if you're talking about a direction, it's like toward the head, but the term actually means brain. So microcephaly, it means a small head, but really it means a small brain. Esophago is esophagus. You have to grow the esophagus properly. We will see kids that are born with esophageal atresia, meaning it has a blind end. It doesn't make it to the stomach. Pelvic. Preemie is the first one. So preemie gravida is the first time you've been pregnant. PG, or the first time of pregnancy, is preemie gravida. Pseudo means false in all aspects of life, but in this case we're going to have a pseudo pregnancy. False pregnancy. Pylor is for the pylorus. That's the lower part of the stomach where the stomach dumps into the intestine. Sometimes that doesn't work. you can have pyloric stenosis or some other problem that doesn't allow the stomach to empty into the intestine. Terato refers to birth defects. A teratogenic substance is like a drug that you take. Don't take this because it's been shown to cause birth defects. Teratogenic. So you can be born with a cleft palate. That's a terata. It's a birth defect. It can be caused by something. It can be genetic. Anti means before, and pre means before. Premature, before it's mature. Micro means too small. Multi means many. Nulle means none. Nulle gravida is a woman who's never been pregnant before. Multigravida means she's been pregnant several times, or at least more than once. Post, after, like postpartum. Amnios is the amniotic fluid. Sciasis is a term for pregnancy. Sciasis. Well, so is gravida. This is all really important, so we have to name it as many times as we can. Sciasis and gravida are used for pregnancy. Some is like condition of. Rhexis, we saw that one show up in the thing because they thought you'd already done chapter 9. Rhexis means to rupture. So great, another RR. We have Raphia, we have Raphi and Rasia and Rhea and Rhexis. Kind of referring to partum. Us, another suffix relating to. So here we have nato, referring to the baby. Pardo is the birth term, most primarily referring to the mother. So antepartum, postpartum, if she had antepartum pain, antepartum bleeding, the baby didn't. That would be, the baby gets prenatal care and it becomes a neonate. Puerpero is also a term for childbirth, as we saw. And totia is a term for labor. So dystocia means an unusually difficult or painful labor. Here we go. Rhea, Rasia, Raphi, and Rhexis. Which means pregnancy. A. Which means labor and childbirth. B. So, of course, we can have itises of everything. Amnionitis, chorioamnionitis, amnionitis. That means the kind of the full width, the chorion and the amnion. Choriocarcinoma would be a cancerous tumor of the placental tissue. Dystocia, difficult or painful, extra painful labor. You can't say painful labor. All labors are dystocic, but this is worse than most. Hysterorhexis, what would that be? Rupture of the uterus. Oligohydramnios, not enough amniotic fluid, scanty. Remember that term, scanty. Oomph, umbilical cord. Umphalo is the combining form. Polyhydramnios, too much amniotic fluid. Abortion. Abruptio placenta is where the placenta, ahead of time, by accidentally, not supposed to, tears loose from the wall of the uterus. An early separation before it's supposed to happen. Preeclampsia is a condition where your blood pressure is increased. It's a kind of a dangerous time. You have to watch out for the mother. It's not life-threatening as long as you control it. Eclampsia is the condition, especially during late pregnancy or childbirth, where the blood pressure goes up so much it can kill the mother and then the baby too. There are times they go ahead and do a premature C-section to end the pregnancy before both parties die. Ectopic always means outside the normal area. An ectopic pregnancy means the child implanted and started growing somewhere other than the uterus, usually out in the fallopian tube. Placenta Previa, the placenta grows down and actually covers the exit hole from the uterus. Placenta prevents anything from getting out. Previa. Abruptio placenta, breaking loose. It's often fatal because the placenta has to be getting nutrients from the mother. The umbilical cord still is there, so it's a, I don't know if they can save some of them or not. Placenta Previa, the placenta is now covering the opening. Ectopic tubal pregnancy, growing out in the fallopian tube, uterine tube. A couple of diseases or conditions. Microcephalus, born with a small head. That's what the Zika virus is causing in such great numbers in South America, in particular in Brazil. Tons of kids are being born with microcephaly. The brain is small, the head is small, and they are severely mentally retarded, usually will never be able to take care of themselves kind of thing. A really terrible situation. Omphalitis, inflammation of the umbilical cord. Omphalocele, herniation of the umbilical cord. Pyloric stenosis, the exit from the stomach is too small. You can't get the food to go through it into the intestine. Tracheoesophageal fistula, what would that be? Yeah, there's an opening that's connecting the two of them. They're not supposed to. Food isn't supposed to go in your lungs, and air isn't supposed to go in your stomach. Omphalocele. Correct labeling. Got to have the O in there. Other disorders not built from word parts. Most of these you know from just life. A cleft lip or cleft palate, they're not identical. The cleft lip is the thing you see from here. It's open here. Cleft palate, the palatine bones in the roof of your mouth don't close, and there's an opening up into the nasal passages. They often go hand in hand because they develop at a similar time, but not necessarily. And they do a good job of surgically repairing those these days. Used to be the repairs were not so great, and I remember, kids that had repaired cleft lips and stuff, and they could barely speak. But now you can hardly tell that somebody had one. Down syndrome is a extra chromosome that causes mental retardation, short stature, very high risk of cardiovascular disease. Erythroblastosis fetalis, this is what we were talking about. If an Rh negative mom, meaning that her blood doesn't have this Rh rhesus factor, has a baby who's Rh positive, that Rh positive, there's something mom doesn't have, her immune system will recognize it as being a foreign substance. She doesn't recognize it until the kid is born because their blood streams don't mix. But at birth, there's an inevitable mixing of blood, just a little bit. Just enough that the mother reacts and starts making antibodies to fight this Rh factor if it ever shows it again. Well, if she has a second baby that's Rh positive, her immune system will attack the baby and kill it. So you take Rogram, it's a substance that causes you not to fight against the Rh factor, and you have to check carefully, especially with the second pregnancy, to be sure that you're not going to be incompatible with your own baby and have your immune system attack it. Erythroblastosis fetalis. It causes your erythroblasts to rupture and to clump together so that they won't go through capillaries. Esophageal atresia, no opening at the end of the esophagus. Fetal alcohol syndrome, retardation and other developmental problems from a mom who drank during pregnancy. A schisis we are going to see now in a couple of different systems. That means an opening that is not supposed to be there, that lets part of your stuff be outside the body. A cranioschisis, part of the brain is out. A spinal schisis is like Spina Bifida. So part of your spinal cord is outside the body. And here we're going to have, in some cases, kids are born with their intestines outside their body, and they have to put them all back in. Respiratory distress syndrome, especially in preemies, because their lungs don't make pulmonary surfactant yet, so they can't inhale, and they have to be put on a respirator of some kind. Spina bifida, this is where the neural tube that encloses your spinal cord didn't close all the way, and part of your spinal cord is outside the body when you're born. Esophageal atresia. That's going to have to be fixed like now. The baby can't eat at all. They cut in there, and they cut this and sew them together. Very mechanical process. Amniotomy. What are you doing? Cutting into it. Episiotomy. Remember the other term for vulva is episio. So episiotomy is done so that the child can come out easier. And episiorrhaphy is done afterward, or episioplasty, afterward to sew it back up. Pelvic sonography with ultrasound. Amniocentesis, getting out some amniotic fluid. An amnioscope, looking in there. Ultrasound image, sonography. Amniocentesis, drawing out just enough of the fluid to measure it. There are certain proteins and factors that they find in there that tell you that the child may be at high risk for birth defects, for Down syndrome, and the like. Amniochorial, inner and outer layer of the placental area. Amniorrhea, a flow out of it. Amniorexis, it bursts. Antepartum, before birth, relating to the mother. Embryogenic, caused by the embryo, so some change in the mother might be embryogenic. Embryoid, looks like an embryo to me. fetal, gravida is pregnant, gravidopuerperal, pregnancy and childbirth, intrapartum, during childbirth, lactic, lactation, whatever, referring to milk, lactogenic, produces milk, so prolactin has a lactogenic effect. Lacturia, you're flowing milk, whether you want to or not. Multigravida, you've been pregnant more than once.
Is the pregnancy and childbirth, is that like literally like someone's having twins? Or
What's that?
is that like if somebody's having twins, or is that just like pregnancy and childbirth together?
No, this is just the overall concept of the whole thing. The gravida, the health of this woman, in other words, during the time she was pregnant and having childbirth was, suspect or whatever. Multipara means she's had multiple kids, been pregnant multiple times, had multiple kids in the past. So if you're writing on a chart for somebody and this is the mother's fourth kid and the others have been successful, multigravida, multipara, she's probably going to do well. This is somebody who's already proven that she's up to the task. Natal, referring to the baby. Neonate is a newborn. Nulligravida, never been pregnant before. Multipara, never had a baby before. Postnatal, after the kid is born. Postpartum, after the mother had the child and is now dealing with her issues. Prenatal care. Primigravida, the first time. Primipara, the first birth. Pseudocyesis. I think this is the only place I've seen cyesis used for pregnancy. The rest of the time it's gravida, but maybe we'll see another one. But pseudocyesis is a false pregnancy. Occasionally women think they're pregnant and they're not. Occasionally men will have the whole signs and symptoms of pregnancy as a kind of an emotional response to their spouse being pregnant. Puerpera or puerperal, referring to having just given birth. A teratogen produces birth defects. Teratology is the study of birth defects. A breech presentation is a kid who comes out butt first. Cephalic presentation is the way they're supposed to come out. The head is supposed to crown, it's supposed to come out, and the body after that, not the other way around. A cesarean section or C-section is cutting across the abdomen to take the child out instead of having a vaginal birth. Colostrum is the first clear milk that comes out. It doesn't have a lot of fat in it yet because the baby can't really deal with fat yet. But it has the antibodies and other nutrients that the baby needs for the first several days before the real milk happens. A congenital problem means genetic, born with it. In vitro fertilization means in a test tube, not in vivo. Lactation, milk. Lochia, vaginal discharge after birth. The meconium is the first poop. Now the baby hasn't been eating, it's been getting nutrients through the umbilical cord. But still there is some product in the intestine that winds up coming out. It doesn't exactly look like baby poop. That comes later. Midwifery, pronounced midwifery. An obstetrician is somebody who deals with the pregnancy part of things. Parturition, oh good, another act of giving birth. But it's kind of like partum, parturition. The kid is coming out. Prepartum, postpartum, parturition is the act of giving birth. premature infant, puerperium, the time between delivery and the normalization of the organs. One of my friends had her first baby, and the attending nurse said, if you're not squeamish and you want to feel something neat, try this. The baby had just gone out. The uterus got so big it pushes all the organs out of the way. She said, you can push here and feel your spinal cord. I mean, your backbone. And she did, and she did. There was nothing there except skin. She just pushed it all the way back and could feel her backbone from the front. But later, everything reorganizes and gets back in where it's supposed to be. Quickening is the first movement of the fetus. Stillborn is a dead birth. Antepartum and postpartum are the mother. Yep, the mother. Abortion, C-section, date of birth, expected date of delivery. So you'll have this. It was expected to come here, but it actually came here. Fetal alcohol syndrome, in vitro, last menstrual period. That's important if you're trying to figure out if somebody's pregnant or not, or if they're having some other kind of a situation. Multipara has had multiple births. Newborn, obstetrics, first birth. Respiratory distress syndrome, particularly in premature infants. Vaginal birth after C-section. So she's multipara. She had a baby before by C-section, but now she was able to have a normal vaginal birth. So it's, sometimes people have a C-section, think they'll always have to have C-sections, but it's not necessarily the case. Might have had a C-section because there was distress of the baby. It was a breech presentation that looked like it was going to be impossible to deliver, but the next one comes out just fine, so to speak. Okay, so 34-year-old gravida 2 para 1. What does that mean? She was pregnant twice. She had one child. So for some reason, the first pregnancy terminated. Her last menstrual period. Therefore, the estimated date of delivery is prescribe folic acid to prevent spina bifida, because neural tube defects like spina bifida are caused in part by lack of nutrients, proper nutrients, mainly folic acid. First patient's pregnancy was complicated by preeclampsia and a breech presentation and had a C-section. So they did a sonograph. There's a female fetus, normal development, positioned right and everything, I guess. And so she went on to have a delivery, a vaginal birth after C-section, 3 days before expected delivery date, EDD. Miscarriage, spontaneous abortion. Tubal pregnancy, we saw. Eclampsia and preeclampsia. Extreme high blood pressure, blurred vision, monster headaches, nausea, vomiting, and all kinds of awful things. Acephaly. So wasn't born without a head, was born without a brain. Can have a career as a politician. Omphalitis, inflammation of the umbilical cord. Omphalocele. Gastroschisis. Everything's outside. I had a student in A&P, my A&P classes a couple of years ago whose son was born this way. And major surgery, put everything back. He still has some problems. Repair. Spina Bifida. So the tube didn't close, and part of the spinal cord actually is outside. It wouldn't be so bad if the spinal cord was in there. It was just exposed, sort of. But it actually comes out, and getting it back in and closing it up is what they do, but it often winds up with some paralysis or dysfunction of the lower body afterward. Meningomyelocele. We haven't even done that section yet. That's the musculoskeletal and spinal cord. But you know what the meninges are, right? They cover the brain and spinal cord. Myelo, remember that was bone marrow, but it's also spinal cord, means middle of herniation. So a herniation in the spinal meninges, spina bifida. Myeloschisis means part of it's outside, right? Gastroschisis, cranioschisis. Cleft lip and cleft palate. In this case, the kid has both. We ran the neuter spay rescue cat program on the Caribbean island we lived on for 9 years. And one cat we caught, nice, fully adult cat. We brought him in, and he actually had obviously belonged to somebody because he was friendly enough that we could touch him and pet him. And so we fed him some milk, gave him some milk and water and stuff, and immediately started pouring out his nose. He had a cleft palate. So our vet that came over and did the work for us cut back the skin on each side, pulled the skin together, and sutured it down the middle, and fixed his cleft palate. Didn't fix the bones. That would have been, a $10,000 operation and might not have been successful, but the cat was pretty happy.
My little sister has a tetralogy of Fallot,
Mm-hmm.
and she has a hairline cleft palate. So it's just like a little, you can't, it's enough for, it to cause problems, but she doesn't have, deformity of,
Mm-hmm.
or anything like that, but I think they're gonna, she's only 6, so I think they want to, shut it.
Uh-huh.
Because it's, causing her to, get all kinds of other stuff, so.
Right.
Yeah.
Well, is there actually, even though it's small, and opening up into the sinuses?
Yeah,
because food can go up there and water can go up there. And
it's causing a lot with her ear infections.
Yeah, sure. Yeah. Down syndrome, the genetic abnormality that leads to mental retardation, short fingers, a oversized tongue. It's hard for them to talk because their tongue is too big for their mouth. Erythroblastosis fetalis, the second pregnancy of an Rh negative mother who has an Rh positive baby, and therefore she has learned to attack the Rh positive thing. Okay, that's erythroblastosis fetalis. Amniotomy. But when I used to, early in the days of A&P1, when I was teaching here, one of my first students here was one of the staff at the women's center, the birthing center they called it at first, and now then it was the women's center or whatever. And so, and of course she was terrific. And after the class, she said, well, anytime you guys want to come over, bring the class over when you're doing reproductive physiology, and we'll, show them through the clinic, and we'll show, movies on childbirth and all this kind of stuff. And we always had a student in the class, they were pretty big classes, who was pregnant. So we always got to listen to the fetal heartbeat. So that was cool. But she said that the myth that the water always breaks, and then it's time to have the baby. She said that really is a myth. She said, actually, the majority of the time we have to break the amniotic sac to let the water come out first, as part of the childbirth procedure. Episiotomy, making the opening bigger. Pelvic sonography, lots of ultrasound these days. And before they knew any better, they used x-rays to check on the kids. That was great, cancer, carcinogenic effects and everything. Amniocentesis, we talked about that. There's an ultrasound image. Amniocentesis we saw. Pseudocyesis. This guy probably isn't really pregnant.
I just saw something like that on Facebook about a couple in Ireland that they were miscarrying and now they're pregnant again. I just literally saw it for
Breech presentations in various formats. And some other congenital problems besides things like genetic problems like Down syndrome or cleft lips and things. An ear pit in front of the ear goes through. Polydactyly. Extra fingers and toes. Happens more on cats than it does on humans, but it can happen. Syndactyly is when you're born with your fingers or toes fused together. Pectus excavatum and carnitatum. Sacral dimple, where your tail is supposed to be. Some kids are actually born with a little tail because the coccyx is the vestigial tail. That's the end of our spinal column here. We have a tail. It's just inside. Most kids. If it sticks out, then you have a little tail, and they cut it off so you won't get laughed at in the locker room. Unusually short fourth and fifth fingers. Prader-Willi Syndrome is a really unfortunate condition where your body cannot recognize satiety. You don't respond to your leptin and ghrelin levels and tell you that you're full. And these kids, they aren't hungry, they are starving all the time. Just ravenous all the time. And I saw a special on one such kid, and they were doing everything. They were feeding him salads at the dinner table, and he got bigger and bigger and bigger and bigger, and everything they could possibly do. And he finally admitted to them that on his way to school and back, he was jumping off the bus early and just digging through trash dumpsters and stuff and just stuffing everything in his mouth that he could find to eat. Yeah. Club feet, equinovarus. This is valgus, this is varus. Equinovarus, horse feet. Kind of the idea of the turning in, looking more like a hoof than a foot, I guess. So equinovarus is a term for club feet. Okay, that one didn't take too long. Let's do some stuff at the back of the room and get the show on the road. Yeah, it's so dramatically extreme that it's life-threatening.